I want to welcome Dean and Professor at USF, Dr. Kevin Sneed. He is no stranger to BNC Live. His patient, we'd like to welcome him back, Mr. Ronald Montgomery, who is a long hauler dealing with COVID symptoms months after being diagnosed. Ronald, welcome back again to BNC Live. Most common symptoms of long haulers include fever, cough, shortness of breath. But based on what you told us the last time, you were experiencing far more than that. How are you doing now, and what symptoms are you still experiencing?
The symptoms I'm still dealing with is, well, right now, brain fog, because for some reason, since the last time I talked with you, brain fog has clouded me, along with the other symptoms that I was having with the dizziness and the bronchitis and the sinusitis that I was having. Now I'm having to fight with brain fog, muscle fatigueness, along with the other symptoms that I've been dealing with.
Mm. Well, we're glad that you're able to join us this afternoon. Dr. Sneed, are his symptoms common this far along? Ronald was diagnosed with COVID last year, and here we are in the end of August, almost September.
Yes, I believe the symptoms that he's experiencing. I can't say they're overly common for the majority of people that get infected, but they are not completely uncommon for people that are long haulers. One of the main things that we hear constantly from people are psychiatric conditions, the brain fog, depression, anxiety. We have a number of people that do report skeletal symptoms, and so much of what he's describing are things that tend to be fairly common in people who are long haulers. The other challenge that many people have, by the way, can be lung scarring and respiratory conditions, and so overall, what he's experiencing are common among people that have long haulers. I do find it heart wrenching that he is dealing with this a complete year, over a year after having been first infected.
Yeah, we feel that same sentiment as well, Dr. Sneed. I want to ask you about, you also have another patient who now needs a double lung transplant. As we try to convince people, especially people that look like us, to get vaccinated, can you just talk about that patient and how they're doing and how old they are? I believe she was a 50-something-year-old woman, fairly healthy prior to her diagnosis.
Uh, yes, again, a patient, really the family member of a patient, but I kind of see them both at the same time. That really had a long, that was in the healthcare field, had absolutely no problems from COVID, just a very mild case, a little bit of a headache, a very mild cough. And then after they recovered, after they tested negative, actually developed pulmonary fibrosis and other conditions. And so now they're on permanent oxygen and probably have been told that the condition is not going to improve for them. And so when we're talking about, wanting to get people vaccinated, we're really at this point not just talking about life or death, but we are also talking about a number of people that are probably going to encounter a decrease in their overall uh, just quality of life. And and one way to prevent that, we believe, is to get vaccinated and try and minimize the overall damage that people have from having been infected. So, this particular patient, the prognosis, I think, will stabilize over time, but clearly is not going to improve back to pre-COVID infection.
All right. Well, Dr. Sneed, we do wish your client the best as they recover. Jesse Jackson and his wife in the hospital, still in the hospital, last reported, battling COVID. Now, Reverend Jackson was fully vaccinated back in January. Are people like Reverend Jackson, who were vaccinated earlier on, but protection has waned off, are they contributing to the increase in hospitalizations that the U.S. is seeing, especially as we hit that 100,000 mark, the first time actually since January?
Overall, across the country, if you continue to look at the number of people that have been admitted into the hospital, you're only finding anywhere from 5 to 7, no more than 10% of individuals that are in the hospital that were fully vaccinated. The majority of people, well more than 90% of people that are in the hospitals right now, that are filling up the ICUs, that are being put on ventilators, that are filling up the ICU space, are people who are unvaccinated. And it's very clear exactly what's happening all across the entire country. And it's hitting people regardless of their background. It doesn't matter if you're black or white. It doesn't matter about your socioeconomic status. The clear demarcation line happens to be whether or not you were vaccinated or unvaccinated. Now, what is happening with Reverend Jackson, we are finding that that can occur if he was vaccinated earlier on in the process. There is a waning of antibody levels and antibody protection, especially in the wake of being infected with the Delta variant. And that's why I think the booster program is going to be critical for people, number one, that are a little bit older, and then number two, that are immunocompromised, and then number three, people that were vaccinated at the very beginning. And we hit that 6 to 8 month mark that the FDA has clearly identified as a point of needing a booster to increase the antibody level.
And Dr. Sneed, kids under 12, so that 5 to 11 age range, are still ineligible to get vaccinated. With COVID in children surging, it's not just adults that are suffering from long hauler symptoms, it's also kids as well. Can you talk about that?
You know, this is a phenomenon that we did not experience during the entire time of the initial one and then second surge. Having the number of children who have been infected at this current time actually having just terrible symptoms and requiring the level of hospitalization. Children's hospitals all over the country are filling up. I'm not sure, we're going to have a little bit more time to witness and feel whether or not they experience long haulers to the same extent. However, we do know that there's a grand potential for that to occur. Simply because they've been infected with a very contagious and a fast replicating variant that is going to attack the very same organs in children that it does in adults. By my math and looking at additional reports from around the world, we know that there's probably going to be a 2 to 3 month mark that we have to really pay attention to figure out what the full effect of long haulers and long COVID will be. And so probably as we're heading into late October, children should be enjoying going out and having Halloween and enjoying candy and having other festivities. We're going to have a much clearer picture during that time period about the potential for long haulers should it occur at a high rate.
Yeah, I mean, Dr. Sneed, we're already talking about a developing brain. So how is this virus going to impact their growth? Cognitive growth, that is.
Again, I think that's going to be an area for research and review. Already, we know, and we have very definitive evidence that came from the UK about the coronavirus, this particular coronavirus affecting gray matter in the brain and having a particular negative impact on just overall brain function. We don't know what the impact will be in children, but over time, I think, research will be done. We'll take additional looks at MRIs if it's warranted in some of our children. But I think your point is spot on, that we have to be critically concerned about the long-term outcome for what many children below the age of 12 who are not in the vaccinated age range may encounter. Now, we're hoping that they are going to be resilient. We're hoping that we're wrong. We're hoping that none of this will occur, and we're hoping that they will resume and have a very normal life. But I think that story is being written and remains to be seen.
Dr. Sneed, always a pleasure. I think we lost your patient, Ronald Montgomery, but please tell him we appreciate his bravery and also taking the time to talk with us. Have a good day.